afternoon. Today is 10th of May, and I am Dr. Ajay Sahu. I am going to talk to you about some issues which I would like to share regarding coronavirus COVID-19 phase which we are going through at the moment. If I look at current statistics, approximately 4.1 million population of the world has been infected with COVID-19 so far, and unfortunately 280,000 people have lost their life in this crisis, of which 80,000 people are alone have passed away in USA, and approximately 31,000 people have lost their lives in United Kingdom. So we are entering into easing lockdown because we see that the first curve and first wave of infections are slowing down in most of the Western countries, as well as in the other countries, especially Southeast Asia. And that's why governments are talking about relatively easing the lockdown. However, we must be very cautious at this moment because we can't relax. We have done all our hard work to keep the number of deaths limited, to keep most of this under the capacity of the medical infrastructure in these respective countries. So we can't let it go, because if we become very complacent at the moment, then we can end up into second wave very soon. And epidemiologists have already predicted that we can have up to 6 waves of this pandemic if we do not get a vaccine, or if we do not get a successful medicine which can stop the severity of this COVID-19 disease. Predominantly, we have seen that the patient lose life because of the severity in the patients, which actually only happens in 4% of the patients who need ventilation. And 85% of the patients usually get mild symptoms. Rest 15% need hospitalization because of the moderate or severe symptoms, out of which 3 to 4% of the patients usually need ventilation. Overall, looking at the mortality, it hovers somewhere around 2% of the total number of infected patients. But there is one worry, that there is a lot of asymptomatic carriers in the community, because usually young people do get the disease. They sometimes get very mild symptoms, but there is a risk that they can pass on to the elderly population, especially to their parents or to their grandparents. Similarly is the case with the schools children, because they can bring the infection and they can pass it on to their parents and the grandparents. However, as the infection is slowing down, governments are trying to open up the restriction, easing the restrictions. But one thing which will sure and short will affect this pandemic is the vaccine. And there is a lot of trials going on at the moment. Hopefully we might have some good news in near future, and we might have a successful vaccine. However, we will have to be very careful about, because sometimes viruses do change strain, as we always see in flu season, that sometimes in the flu season the vaccine is usually given in October time, at the beginning of autumn, and sometimes we see by January or February that the virus has already changed the strain, and then we have to come up with new vaccines. So we have to be very careful and cautious, and not become complacent. We have to maintain social distancing. This is a new virus, so we do not know much about this. The best thing is to prevent the disease from happening, or contamination. Best thing is to slow down the spread of this disease, because according to the epidemiological curves, until unless either 70% of the patients get vaccination or get infected, we are not going to achieve herd immunity. And that's why it becomes really important to safeguard ourselves. Uh, I would come to second thing from here, that because of this crisis, I myself has had a lot of introspection. I have spoken to different people, and I think many people have thought about this, that the world is changing, and probably the world will never be the same as it was before COVID crisis. Um, One thing which we all should at the moment think and decide, that we are going to look after ourselves in a much better way. We should look after our own health. That is one thing which will I would definitely like to emphasize, because this is really important from this crisis that we should learn. This is all about, if you understand that Charles Darwin came up with the theory of evolution and survival of the fittest many years ago, and he mentioned that only the species which makes themselves fit to live in this nature survives, and that what nature is doing at the moment. So if you look at what it does, it affects most of the vulnerable people, especially elderly. If you are more than 70 or 80 years of age, the mortality rate is very high, or if you have multiple comorbidities. So that is a significant population, unfortunately, which is getting severely affected, and most of these fatalities are shown by these numbers. So we have to make sure that we become healthy, we achieve or adopt a healthy lifestyle. Especially the most important thing I would emphasize is the obesity, because being overweight leads you to a lot of diseases, especially type 2 diabetes, high blood pressure, cardiovascular disease, stroke, and that is, they all are interlinked to each other. And the basic reason behind is obesity and inactivity, that is lack of exercise. So we should all at this moment decide that we should always keep our weight with a body mass index less than 25, or ideally we should achieve the BMI of 22. BMI is a straightforward formula, and we can calculate our own BMI, and we can calculate how much maximum weight we are allowed depending on this formula. The rest of the things which are really important is to do regular exercise, at least 30 to 40 minutes every day. We should try to adopt some more healthy lifestyle, like eating salad, which will be less calories and which will give us sufficient vitamins and minerals as well as iron for our regular daily life and development. One important association we have come across during this crisis is vitamin D3. That vitamin D3 is very very important, and people with low vitamin D3 are more predisposed to COVID-19 risk. So we should try and sit in the sunshine at least for 15 to 20 minutes every day, if possible between 11 to 3 o'clock. That is really important. We all should talk to ourselves, and we should try to understand our own body. We should try to increase the immunity, which happens because of healthy lifestyle, hygiene, and regular exercise. We should try to do exercise so that we sweat. That's really important to sweat, because that's a healthy habit, and that leads to that saves us from a lot of diseases. That's Our heart and lung capacity should be increased, which this crisis is teaching us, because COVID-19 pneumonitis or pneumonia does affect your lung, and so your heart and lung have to be very strong, just in case if you unfortunately catch this infection. So these are really really important things. We have to change the way we live. We have to do some training for ourselves. I would say that try to, especially this crisis, till there is uncertainty, till this unprecedented era lasts, even if we might get a vaccine, but the trial of this vaccine and the availability of this vaccine to common people, which will entail 70% of the 7.8 billion population of the world, is going to take a long time. And so we have to be very very careful. I must admit that we should all try to achieve the healthy habits. We should change our way of lives. We should try to avoid other injuries, especially in this era when COVID-19 is going on. We should try to avoid to put unnecessary pressures on the hospital. We should um, try to drive in speed limits so that there are no road traffic accidents happen. We should try to avoid injuries, unnecessary injuries. These days we are coming across a lot of DIY related injuries, and that is in our hand. If we take extra precautions, we can avoid these injuries. And because if somebody ends up in the hospital at the moment, the resources will be even more stretched, and there is a possibility that you might not get ideal treatment, which is always a risk because of the ambulance services are already so much stretched. uh, I'm seeing on social media people are trying a lot of new dishes. They are sharing their hobbies, which is very good. People are doing gardening, but please try to avoid injuries. Preparing and sharing ideas of new dishes is very very good, but try to promote healthy eating habits even with your friends rather than just for the taste buds. It's very very important, and keep in mind about the chart with calorie intake and calorie output, that how much calories you have taken in and how much you have spent during the day. If you have any surplus, you should try always to burn those calories by doing the exercises. I will suggest try to do some meditation, try to do some spirituality thoughts, do some introspection. That's really important. This is even more important for the people who are more than 40 years of age, because they have to live longer, but they come in that middle age group where there is still risk. So for the next 2 years, I would suggest something that we should try to avoid unnecessary travel. We should not plan any too many holidays during the next, because this is going to be uncertain period. Try not to eat in the restaurants or try not to go to the crowded places. Try to avoid these things. Avoidance and prevention is the uh, best advice at the moment, that what I would say. So try to stay healthy, and I would wish you best of luck and a lot of good health. I will try to convey my message, but I will reiterate: lose weight and try to do regular exercise. This is the most important thing which will pay you off. Even if we get rid of COVID crisis in next few years, but I would say that try to make it your way of life, because that is the most healthy way of life, and this is really important for you having disease free healthy life in future. All the best. Bye bye.